One of the fundamental principles in the realm of healthcare providers is the commitment to do no harm. Venturing into the healthcare field signifies a genuine concern for individuals, accompanied by empathy and compassion. But, with this, another commonality must be considered: to err is human. Mistakes and errors are part of everyday life. Sometimes, they are avoidable, and other times, the circumstances are so far beyond reach that nothing can be done to prevent the mistake. Medication errors have been no exception to this. Healthcare programs, particularly nursing programs, across the world teach 5, 6, or up to 10 rites of medication pass. They also stress the importance of these rites being checked 3 times. Along with these rites and checks, the implementation of electronic health records, EHRs, and continued improvement in prescribing and preparing medications are just a few examples of the never-ending improvements meant to reduce medication errors. Despite these proactive measures, the World Health Organization, WHO, estimates an alarming annual cost of $42 billion globally attributed to medication errors. Any healthcare professional may have several guesses as to what may contribute to these numbers: short staffing, fatigue, mental strain, prescribing, transcribing, etc. Indeed, many of these elements have played a role in various medication errors. This education aims to delve into the common types of medication errors, explore the underlying root causes, provide insights into identifying and classifying these errors, and offer strategies to prevent medication errors proactively. Before we embark on exploring this topic, let's first paint a clear picture of what exactly a medication error entails. The essence of a medication error is that it's something entirely preventable. The National Coordinating Council for Medication Error Reporting and Prevention, NCERS, describes it as any preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is under the control of the healthcare professional, patient, or consumer. Medication errors are different from adverse reactions or effects. The difference is that an adverse reaction is unpreventable. An adverse reaction is like the unexpected twist in a plot that you couldn't have seen coming. In an adverse reaction, the patient has an unpredictable response to a medication that is the standard dose for someone of the same size and condition. Another way to think of an adverse reaction is an amplified side effect. This may be a known or unknown effect. For example, some people experience palpitations and anxiety when given a dose of corticosteroids. This is a known potential effect of this medication. Although it is not a preferred effect, it does not mean a medication error has occurred if the individual experiences these effects. If the individual is given double the intended dose by mistake, be it that the provider ordered too much or the nurse administered too much, leading to the individual experiencing these symptoms, this would be a medication error. Administering above the intended dose would still be a medication error even if the individual did not experience these symptoms. As you can see, there are likely many more medication errors than reported, as not all are accompanied by symptoms. An allergic reaction would fall into the category of adverse reactions rather than medication errors. This is unless the individual's allergy is clearly documented in their chart, and the medication is administered despite the allergy being clearly documented. This is not an uncommon error and highlights why verifying medication allergies is critical to patient care, but we will discuss this in more detail later.